nebulizer and inhalation medication use. Check with the patient or caregiver for use of any nebulizer and inhalation medication use. This is essential if the patient has history of airway spasm due to asthma, COPD, and seasonal allergies. Check with the patient if the recommendation was for regular everyday use or use as needed. If the recommendation was for as needed use, check with the patient on the number of instances the nebulizer and inhaler medications were used lately in the recent past. This provides some information on the exacerbation of patients' disease conditions in recent times. Check for patients' independence on use of nebulizer and inhaler medications, especially if the inhalation medication is newly prescribed. Educate the patient to promote patient independence and compliance with use of nebulizer and inhaler as applicable. This forms an important piece of patient education information, as the need for inhalation medication can be felt at random and at times when caregivers are not around. Check for any history of opportunistic fungal infections in individuals using steroid inhalation medications, such as budesonide and fluticasone. Inspect the oral cavity for any symptoms of active thrush, such as white patches in the mouth with soreness. Instruct the caregiver upon checking the patient's oral cavity periodically for any evidence of thrush. Educate the patient on cleaning the medication cup and mouthpiece of the nebulizer. It is best to clean them with warm water after use and let them air dry by keeping on a clean towel until it is time for next use. Instruct on making sure the cup and mouthpiece are clean before use, as any dust accumulated in them could be inhaled straight into lungs during use. Instruct the patient upon using a spacer with the inhaler and a proper fitting mask covering the nose and mouth, creating a seal to help prevent medication loss. Having the mask in place for 5 to 10 normal breaths after dispensing each puff of inhaler medication can contribute to maximizing the medication delivery and the intended benefit. Instruct on replacing the cap on the inhaler when the inhaler is not in use. Educate the patient on cleaning the spacer with warm water after use and let it air dry by keeping in a clean area until it is time for next use. If a nebulizer mask is used, check for and educate the patient on ensuring proper fit of the mask to prevent loss of medication mist. Instruct the patient on checking for expiration date of inhalation medication and doses of medication left in the inhaler, which can help order a timely refill. Sleep apnea. Determine the possible contributory factors for patients' sleep apnea based on the history and physical received and your assessment of the patient. Instruct the patient regarding factors contributing to increased risk for presentation with sleep apnea, such as obesity, frequent activation of allergies and nasal congestion, smoking, excessive consumption of alcohol, use of narcotic pain medications, use of tranquilizers, and poorly managed congestive heart failure and stroke with unresolved residual deficits. Check for any recommendation made on use of positive pressure ventilation, such as continuous positive airway pressure or bilevel positive airway pressure, and patient compliance with the same. Collect detail regarding the pressure the device is run at. Instruct the patients upon compliance with the device use as recommended. Check if compliance with use of the device offers any needed relief. Check for continuation of symptoms, such as difficulty staying asleep during the nights with interrupted sleep pattern, waking up in the morning with headache and irritability due to restlessness in the night, daytime sedation as a compensation to the poor quality of night sleep, inability to concentrate and pay attention during the day due to daytime sedation, loud snoring due to breathing through obstructed and narrowed airways, excessive dry mouth in individuals breathing through the mouth with mouth wide open. It helps to involve the partner or caregiver on this issue, as they are more witness to the patient's experience of apneic spells and snoring behaviors. Educate the patient and incorporate appropriate management measures. Management measures can include compliance with smoking cessation, losing a few extra pounds, avoiding outdoor environments during the allergen season, prophylactic intake of recommended antihistamines to prevent activation of allergies during seasonal change, and limiting alcohol intake, as applicable. Excessive use of narcotic pain medications and poor management of congestive heart failure in individuals with history can also predispose the patients to presentation with sleep apnea. Encouraging patients with history of narcotic abuse for reduced dependence on narcotic pain medications, instructing patients on ill effects of long-term narcotic use, relying on non-narcotic pain medications, and practicing alternative pain control measures can help improve outcome of sleep apnea. Promoting compliance with heart-healthy diet and recommended medication intake for individuals with CHF can also make a positive contribution. Educate the patient on cleaning the mask cushion and headgear every day with gentle soap and warm water and let them air dry before they are ready for next use. Also, instruct on having the mask cleaned before every use, as any dust accumulated in it could be inhaled straight into lungs during the use of the device.